Hello, I'm Dr. Michael Higgins. I'm a joint replacement and revision specialist with Tidewater Ortho. I'm going to speak to you today about knee replacement and a procedure that I do called the ready knee. First, let's talk about knee replacement. This is a procedure for people that have arthritic knees. That means the cartilage in the knee is worn out. And if you have an arthritic knee and you're having a knee replacement, what you're going to have with that surgery is an implant put in just like this, what's shown in this model here. So with the knee replacement, the cartilage is replaced. So there's a metal cap that goes on the end of the femur to replace the cartilage on the end of the femur, and a tray that's made of titanium that goes on the top of the femur. A plastic insert goes in that. So that's what your prosthesis is made of. That's what the knee replacement is made of. The way I do the surgery is a muscle sparing approach. And that's my approach to all my joint replacements, hip and knee. And what I mean for a knee when I say muscle sparing is that when I do the surgery, in order to get these implants into the knee and rebuild that arthritic knee, I don't cut any muscles and I don't cut the quad tendon around the knee. With the traditional knee replacement, your surgeon will make an incision along the medial side of the knee capsule and then carry that incision up through the quadricep muscle and quadricep tendon, splitting the quad muscle and giving exposure to the knee. The way I do the procedure is through a subvastus approach. And so it's the same skin incision and the capsule of the knee is opened up, but I go below the vastus medialis. So I'm not cutting the muscle, I'm going below it, and that muscle is lifted off of the end of the femur, exposing the knee. So in doing the surgery this way, the extensor mechanism, the quadricep tendon and the quad muscle is not disturbed, it hasn't been cut. So after the surgery, everything slid back into place, and you don't have the same damage. So when you get up after surgery and start moving your knee, bending your knee and walking, you're not going to have the same pain you would have if these muscles and tendon were cut. You don't have the same tension on them. You're going to have better strength. So what that means is a quicker recovery. So a quicker recovery is what everyone wants when they're having a knee replacement, both the surgeon and the patient. What we're trying to do is accomplish the surgery and minimize the amount of time you need to spend in a hospital, spend on a cane, spend in rehab, and get you back on your feet doing the things that you want to do. The ready knee also uses computer navigation and robotics, which is the most precise way of doing a knee replacement. In addition to that, with the ready knee, I'm using advanced multimodal pain control, which means stopping pain before it starts, which enhances a quicker recovery. And this ready knee procedure is only done in an orthopedic specialty hospital, which means less chance for infection. I'm Dr. Michael Higgins, hip and knee replacement and revision specialist with Tidewater Ortho.